The past 1 month has proved extremely challenging for Wangui Waweru, a mother of 3 and a snail farmer. Wangui characterizes these days as quiet, lonely, and full of negative thoughts after family and friends reportedly said that she tested positive for the coronavirus and seemingly ostracized her. Life was normal for her until she met 2 clients in mid-March who were isolated at the Mbagathi hospital for having come into contact with a Covid-19 positive case.
I had a meeting on 12th and interacted with so many foreigners who are my clients. After a few days, like 4-5 days, I happened to realize 2 of my clients who I was with in Nairobi were isolated at Mbagathi in Nairobi, because they were in contact with one of the cousins. I happened to be sick. I happened to have a severe headache. I would vomit. I had a sore throat.
Wangui was admitted at the Nakuru Level 5 Isolation Center on the 26th of March. The following day, samples were taken to the National Influenza Center for testing. On the 28th of March, Wangui was given a clean bill of health after the tests turned negative. She was immediately discharged from the isolation center, but upon returning home, many treated her strangely. For the 2 days, rumor had it that she had tested positive for the virus. Though that was not the case, her neighbors bought it, and her family members, who she expected to be by her side, appeared least bothered.
I expected them watanipigia simu waniulize what is happening, ama maybe ugua polio ama something like that. But ilikuwa vingine, because I have 2 family members, even one of them being my brother, called me, and instead of kuniuliza what is happening, he asked me that yani uko mgonjwa na unakujanga kwetu.
To add insult to the injury, some neighbors conspired to burn down her snail business on grounds that they caused the virus, a business that was booming before, and now her only source of income was taken away. At this point, life became unbearable and she decided to speak up.
I would even find myself trying to commit suicide. Najipata the forende nimelala kwa fro. Na nilikuwa najinyonga jana. Generally, I would say that the health department and the authorities, now the chief and sub-chief, they have been so close to me. They have been so supportive.
Dr. Samuel Kingori, a public health officer in Nakuru, says more measures need to be put in place to ensure the community is aware of and curtails the stigma.
And immediately after testing, we are giving results. And when you give the results to the person, they go with the results to the ground, and they're able to show even those people who want to know whether they are free from the disease as a way of accepting them back to the community.
Nimefika mahali nimeamua, let me forgive. When you see someone is sick, leave alone the COVID-19. Hata unasikia mtu akona malaria, ama unasikia mtu akona shida ya akanataka someone to talk to. Just try to be there for them.
A month after she was discharged from hospital, Wangui's family is yet to communicate, but Wangui feels that these challenges have made her stronger than before. She now hopes to become an ambassador of change, encouraging those who may have gone through such stigma. Wangui's story is that of resilience amidst all the negativity from the surroundings, but it's still clear that the government needs to step up community awareness on coronavirus to beat the stigma that is slowly crippling in. Maryanne, Nyambura, Citizen TV, Lanet, Nakuru.